Adam Johnson is live in Midtown Manhattan at the Jefferies 2010 Global Life Sciences Conference with an exclusive interview. He's joined now by Clay Siegall, CEO of Siegall Genetics, a company that develops cancer-fighting drugs. Adam, good morning.
Hey, good morning, Margaret. That's right. We are here with Clay Siegall. And Clay, you just announced some data at the ASCO conference. That's the big cancer conference. It was just this past weekend and as well as yesterday. Tell us what you announced.
Yeah, we announced data that shows that our top drug, brentuximab vedotin, can be used in patients, and you can retreat patients. You can get responses, retreat them later, and retreat them again.
And just so we understand, because that's a big word, all right, we're talking about Hodgkin's lymphoma, cancer within the blood, white blood cells.
Correct. It's a blood cancer, and it affects about 9,000 to 10,000 patients a year in the United States.
And what is it that your drug is doing that other drugs haven't done before you? And granted, it's still being tested, so it's not on the market yet. But what is it doing that other drugs aren't doing?
Our drug is an antibody-based drug. It's a protein that targets the cell surface, so it doesn't target normal tissue. So we can get an effect on the cancer itself, on the tumor cells itself, without providing toxicity to normal tissue, and we think that that's important, and we've shown in early clinical trials that this product can really have a profound anti-tumor activity on a large patient population.
It goes after only the tumor as opposed to killing other cells around it, as some of the old chemotherapy methods had done.
Exactly. Standard chemotherapy usually targets dividing cells. So any cell that divide, and important cells that divide include bone marrow cells, so you have a lot of toxicity. Whereas this is an antibody that targets a specific receptor on the tumor cell surface.
Now I have to ask you, the stock traded down after the news came out. Was it in any way disappointing?
Well, you know, it was really the macro market. The market was down. Siegall Genetics has 3 late-stage clinical trials ongoing in 2 different drugs.
And that data may come out at the end of the year.
Yeah, that's in the second half of this year. We have our 3 late-stage data sets coming out. We're very excited. Our major investors in the company are excited, are very supportive about our data. I think that
So that's the play. It's the second half and revenue positive in 2012?
Perhaps. We're not a revenue story right now. We do have revenues, but moving forward, looking toward our data set is key.